Hi, Kristen. Hi, this is Neil. We're going to be getting started in a minute, so Josie, am I right? We'll just be on hold for now, and then.
Well, yeah, I think actually we're probably ready to go.
Great.
And we'll start with introductions. And Kristen, since you're on the phone, why don't we start with, this is Courtney Burke. Why don't we start with you on the phone, and then we'll go around so you know who's in the room.
For AHRC as a DSP. I have autism. Yeah.
Great. Thanks for that introduction,
Thank you.
Kristen. And I know you're going to be co-presenting with Neil a little later, so looking forward to that. So we're going to go around the room here. So again, Courtney Burke.
Craig Roberts, OPWDD.
Hi, Connie Donahue from the Department of Health, Bureau of Early Intervention.
Jill Pettinger, OPWDD.
Good afternoon, Donna Bradbury, the Office of Mental Health.
Christopher Soriano, New York State Education Department, Office of Special Education.
Good afternoon, Carolyn Apiersky from New York Alliance.
Josie Yankowski from OPWDD.
Ann Hardeman from the New York Alliance.
And Neil Mitchell from OPWDD.
Great. So I know Josie mentioned this at the beginning of the meeting, but I'll just say it again in case, I don't know if the mics were on then, to remind anybody here who's for the public comment period, that there's a sign-in sheet in the back of the room. So I think the first thing on the agenda today is the Self-Advocate Subcommittee Report on Technology Utilization, and I think Neil and Kristen.
Okay, so thank you very much. Basically, I can give the group a little bit of background on this work group, and Kristen Thatcher, who is a work group member, is also on the call and will be speaking in a little, just a few moments. So this is a work group of self-advocates with autism. This is something that, microphone closer, sorry. This is a work group really originally convened by the board last year of self-advocates with autism. So these are people with autism advocating for themselves and wishing to provide input into the work that the board is doing. And so they originally gave input into the recommendations for the board, and their input is included as Appendix C in the board's initial report. So this group met again with a few new members in November to discuss assistive technology and the board's recommendations related to technology. And just to provide a little background too of who I am, my name's Neil Mitchell. I work for the New York State Office for People with Developmental Disabilities, and I help to coordinate the work group. So I'm here to report on some of the main points of the discussion, and as I mentioned, Kristen will also be speaking after I get through just three points I'd like to highlight first. So the first point is that, as with all things in service delivery, it has to start with the person. And really everyone emphasized this, is that the kind of technology that a person uses is similar to the type of services they would use, and that it has to start with an assessment of their skills, interests, wants, and abilities. And this is sort of in service of personalizing the technology to the individual. You know, answering the questions, is this something that the person will truly use? Is it set up correctly, and do the people in their lives understand how to use it and what the purpose is, sort of what goal the person is working towards? And so that is really the larger question, is what goals can technology help the person reach? The second main point that came up through the discussion is a need for awareness of the options. And so there's a lot of assistive technology out there. There's new things becoming available every day. It's really pretty amazing. And I think, there's just many things becoming available. So one thing that was helpful is information sharing, both with support staff and with families. And this could be opportunities for training, just opportunities for learning, and opportunities to keep up to date. These are all ways to increase awareness about the options and how they can be applied in serving people with developmental disabilities with autism. And there's also a need for buy-in. This was also discussed by the group, and for people to understand the benefits. So, for example, there are pieces of technology designed to be like a toy, to teach children with autism about emotions, so that they will want to use them, for example. This is an additional benefit, but to someone who doesn't understand the purpose, it may just look like, playing games, is the way that one of the work group members put it. So making sure people understand the purpose and sort of have that buy-in to it as well as also another important part of awareness. And lastly, I'd just like to point out that there are many beneficial support possibilities with a variety of technology. So there are some specialized technologies, like I just mentioned, the toys to help children learn social responses that are appropriate. But much of the technology identified by the work group is generic. It's the same technology that everyone would use, just used maybe in a different way. For example, the most useful technology identified by the group was a smartphone. And this can be set to issue prompts and reminders, for example, which would be more important for someone with autism, just sort of going about their daily life in a more independent way. And that can be accomplished through a calendar app. So people adapt it for their own use. And I think that it really, sort of everyone does this, and they were sort of speaking to how it could be adapted for their specific situations. We also had a discussion of smart home technology, which can be used to support greater independence in living. And so now I'd like to turn it over to a member of the work group, Kristen Thatcher, to speak about her planned use of smart home technology in her new apartment. So go ahead, Kristen.
I'm moving out of my house at the end of this January. I'm going to move out January. Very excited. So I got this lucky enough to get this technology called the Smart Tower. So it will help me to let me still have my independence, but also it'll keep me in task. Like, let's say I'm cooking something, right? And I leave the kitchen maybe for 10 minutes. There's a sensor on it, and it'll say, Kristen, you have to return to the stove. Your stove is still on. So I don't burn my food or I don't start a fire. So it's really cool. And they also have, this has a lot of sensors. And it can remind me to do my laundry on Wednesdays. It can remind me to take my medicine. Don't eat that, actually, but anyway, for other people, they need that. But it can also, let's say there's fire or something. It has like a smoke detector, and it'll tell me there's a fire, gotta get out. But yeah, it's just like a really interesting thing to use, and it can remind me to go get my Uber or other things I have on it. So yeah, it's getting really interesting. I can't wait to move out and new experience.
Great. No, that's terrific. And that's, exactly what the group was talking about in terms of supporting independence with technology. And Kristen, I know, worked with good staff to put together a plan really all about her, linked to the people important in her life, and to support the things that she's interested in doing. So I think it's a terrific use of example, kind of what can be done with assistive technology. So that was our presentation. So thank you very much for the opportunity to come and speak today.
Thank you.
Questions for Neil or Kristen? That's great. Thank you.
Thank you.
All right. Next on the agenda is also a presentation on assistive technology, and we have Ann Hardiman and Carol Napersky from the Alliance.
I just wanted to, what was the device that was mentioned?
The Smart Tower is what Kristen was speaking to. Yes, I had not heard of it either. I thought it was very, very interesting. It kind of pulls together a lot of different smart technologies into a single piece of equipment that has sensors. So it's kind of bringing a few different pieces together in a way that can work better for people.
Thank you.
Okay. Thank you.
So thank you, Courtney. And Kristen, hi, it's Ann Hardiman. Kristen's a great advocate. I think she got our Excellence Award one year for being such a fine advocate. So I'm happy to hear you're moving and have some technology that's going to help you. Neil and Kristen sort of gave a great introduction to what we're going to talk about, Carol and I. I'm the Chief Innovation Officer at the New York Alliance for Inclusion and Innovation, and our organization is a bit over a year old. We are the merged associations, NYSACRA and NYSRA. we came together and are leveraging the good work both organizations did and more. And Carol, do you want to introduce yourself?
Oh, sure. Good afternoon. My name is Carol Napierski, and I'm the Vice President, Program Development and Grant Management. And I've been with New York Alliance NYSACRA for almost 5 years, and I came in through one of our grants, our BIP grant, and have been working with assistive technology and housing and person-centered. So I'm very excited to be here to talk about assistive technology.
You know, we're really fans of assistive technology, as you will be able to tell from our enthusiasm. And you know, just a little bit more about the New York Alliance, because we're trying to get out our vision and mission and core values. And just a tiny bit, we are a provider association of providers all around the state. We do love to include and involve stakeholders in just about everything that we do. And I would just say that we are building in assistive technology into just about everything we can at the New York Alliance. All of our grants, like our housing grant that we're happy to have from the DDPC, we are building in assistive technology to help people moving into, just like Kristen, into their own place, or to enhance where they are and to be more independent. So for us, it's all about empowering the person to feel more independent and be more independent. And Carol's more of the expert. You're going to hear a lot from her throughout this, but I'll be chiming in too. So,
And thanks again. I'm so excited to be talking about this. So I had started my career in the 80s as a special ed teacher, and I was actually making adaptive switches. And when I think about what we were using, which was certainly, you know, cutting edge in the 80s, using adaptive switches to turn on blenders and things like that, we've really have come a long way. You know, things that are naturally occurring in, you know, the Best Buys or in just the marketplace, we're able to adapt. So Ann and I will talk a little bit about the definition of what we're talking about with regards to assistive technology. We'll talk about some of the, what we kind of categorize the types of technology, and then we'll give you some examples. So this is technology, so let's see if it works. So the first thing is, I just kind of wanted to, so I'll be on the same playing field with regards to the definition. Assistive technology, I think of that term as being more the durable medical equipment, you know, the augmentative communication systems, the electric and manual wheelchairs, and environmental modifications, ramps, and things like that. We're talking here about what I call, and we've been hearing this term coined for the last maybe 2 or 3 years, is enabling technology. Technology that we'll be able to promote independence, increase choice, increase control over our environment. And some of the things that we're talking about here are, as much what Kristen was mentioning, is the smartphones, tablets, laptops, Google Home, we all use that, and medication dispensing units. So those are the things that we're going to be talking about here. So in my mind, and you know, certainly we'll talk about this later in the presentation, New York Alliance has a very invested enabling technology committee. So we've talked about the different categories of this enabling technology. And some of them are simple apps. Some go into what we call mainstream technology, things that you can purchase at the Best Buys, Targets, and online, to the vendor equipment. And I think some of the vendor equipment, the more customized equipment, Kristen may have been talking about, is that smart home technology. We've seen that in a couple of different marketplaces where it's a whole unit that will help to control an environment, whether or not it's stove sensors or so forth. So those are the 3 categories of enabling technology that we wanted to go through. And it's going to get us settled for person-centeredness.
So again, Neil and Kristen underscored where we like to start, and that's with the person. You know, there's no cookie-cutter technology for everybody. In fact, there's a couple of research-based articles out there that initially people are buying too much technology. Some of the elderly are either being conned into or kind of sold something that's pretty expensive that they maybe don't need, that you could go to, you know, the local Best Buy or target and get something that can be helpful to you. Like if I had my phone with me, you'd see I have an app, My Canary, where I get to look at my dogs to make sure the dog walker came. So it's that kind of thing that you can buy off the shelf. But it's all about starting with the person, their circle of support, their the direct support professional that works alongside them, and what can be most helpful and empowering to the person. And I would just say that, and we'll talk a little bit more about a BIP pilot that we did, and that communication and education is really important. Some of the DSPs were a little bit offended in the project we were doing that they were being replaced, so you really need to communicate about the reason for technology and how it can enhance their work. And it also is sometimes a little baffling. We had an example of a person who had something that he really liked to use with his television, and it wasn't working, and he had a meltdown, and the staff weren't sure what was happening, and there were consequences, and it really was a battery in the device that he needed. So it's really important to educate and perhaps have some clarity around each person and what's important to them, and how you could have an easy fix. There's obviously things that have to go maybe for a bigger fix if it's not working. But so starting with the person, what they need in their planning, in their IM, we talked about it as in their ISP. We would like every person in their circle or their service plan or their life plan to begin talking about assistive technology and what might be helpful, what could really help them with their independence. And I think sometimes that happens, but not as a rule. And I've talked to a couple of the CCOs about building that into the conversation and having it be more planful. Outcome-based, I think we're all focused on, good outcomes, or perhaps even finding out what doesn't work, but outcome-based so that we're setting out a goal for using a GPS watch, perhaps. I'll probably interfere with an example Carol's going to give later about a man who just really wanted to visit his aunt when he wanted to, or pretty much when he wanted to, and so using a GPS watch that had more potential for him to get there, to find out when the train was coming or not coming, to notify staff if the train was late. So, there's some real benefit to, and people feel really empowered. So I put a little quote in here. We have been working with a vendor, Simply Home. There's lots of others, though, that do a lot of the same thing, but in our BIP project, we worked with Simply Home, and they're out of Tennessee, so they do a lot of work and have a lot of videos from Tennessee. But one executive director said, people don't want a lifetime of good services, people want a good life. So I think assistive technology can get towards that.
So I'm going to go through a couple examples of apps and mainstream technology and also the vendor-generated technology. But before I move forward, I just wanted to kind of reinforce that we don't look at the technology first. We're looking at the why. If somebody wants to learn how to travel in their community, that's the why. That's what they want to do. So then we'll bring in technology to support that why so it aligns with the goals. Or if somebody wants to be on time, bring in technology for that, or live by themselves.
My husband needs it.
So these are fun. So we'll start with the least restrictive, in my opinion, which are some of the apps. Just general reminders. I think we all use these. Like Ann was talking about, I have a fitness tracker on my phone, my iPhone, that will tell me how far I walk or how far I didn't walk that particular day. Calendar designs, travel, fitness, text-to-speech, and speech-to-text. And later on in the presentation, Anne will go through some of our main smartphone devices, how they already have technology for accessibility built into their features. And then instructions. We can go on to an app to learn how to cook. All of these things are just naturally occurring technology. And not necessarily needing to go to the more advanced. And then the mainstream technology, things that we buy at the local stores or order online, certainly cell phones is what I consider, tablets, the video doorbells, we've all seen the commercials on those that you can buy at Home Depot, Google Home. This is really kind of neat, and I didn't even realize it. It's called the Tobii Eye Tracker, and I'm going to tell you it's $170, but for somebody who is unable to use their fingers to text on something, the eye gaze can start typing out a word for $170 that can interface with an iPhone or a laptop. Just pretty amazing things. And something like that several years ago in what I've remembered was like $2,000 or $3,000. Dusk to dawn light bulbs, so if somebody's worried about, a little safety, $6 light bulbs can be brought in. Very easy. Facebook portal, which is really interesting. So somebody who may not want to, and this is killing Ann and I for sitting here and not moving around, but if somebody likes to talk and move around, the Facebook portal will follow the person, which is real important, and really can continue that engagement. And the most recent Apple Watch will send an alert to somebody if you have fallen. So if you have somebody who you may have staff around for those just-in-case moments, you can set up your Apple Watch, which everyone except for me has one, and they can use it for notifying if there's somebody had fallen. So again, really simple things that are naturally occurring. No, gosh, no. So the next one, and you'll have the active links in here, is we kind of discovered this on our own. We had met with Microsoft. Microsoft has offices, and this is not a commercial because you'll have all four entities listed here. But they have a store in Buffalo and Syracuse, Westchester County, much like you'll see an Apple store. So we met with them for an hour, and we went through all of their accessibility features built in their system. And it's pretty darn amazing. As simple as PowerPoint slides, you can have it now closed caption. And you can have it closed caption to a different language. So if you're working with somebody and, Spanish is their primary language, you can set it up so it's closed captioned to Spanish, and then you can also set up a system where it's, text to speech or something like that. So those are things that are already built into the system. And you'll see the same thing with Apple. So you'll look at, and again, you'll have all the active links. I don't want to spend that much time with you on this, but you can go, if you have an Apple product, you can go onto this link and you can, look at some of the accessibility features for somebody who is has a hearing issue or visual, and you can set up your devices accordingly. And Apple also has a system where there's an Apple hearing aid that you can align with your phone, and it will make the transition. So if you're outside, it'll have a certain system built in, but if you move inside, it'll change the focus of the auditory. So each one of these guys have it. Google, Microsoft, the Android. So we just have to look at our smartphones right now or our smart devices to pick up all these naturally occurring accessibility features. And also the iPad. The most recent iPad has a control with voice, so you can use your voice rather than typing out a message, which is neat. So here are some of the vendor-generated technology. Telehealth, medication dispensing units, and we'll go through that a little bit more when we talk through our BIP grant, environmental controls, and sensors. I also am very involved with one of our grants on housing, and I was in a meeting last week and the builder was talking about one of the persons who just moved into a new complex has an issue where they forget to turn off the water. And one of the simple things is just getting a water sensor. And if they have a security system, or you can even download it onto your phone, it gives an alert if there's any little bit of moisture. So there's simple things that can help a person to stay in their homes too.
So I want to talk a little bit about how we got started sort of moving into this space a little bit more, and we're really appreciative of OPW and New York's Balancing Incentive Program grants, because we really took the dollars from from what we applied for and have really been leveraging them in a lot of corners since then. So we had 3 areas we submitted in our grant, and it was about person-centered thinking and planning, and housing, doing housing differently than the kind of often used certified 24/7 or programs, and assistive technology. And we sort of wove them together, finding some consultant vendors that would help us really work through some things in all of these 3 areas. And the person-centered thinking and planning, we used Michael Smull and his associates, and we now at the New York Alliance have a person-centered thinking and planning expert on staff, and we're providing training all around the state. And we have trained up 7 person-centered planning trainers that are situated around New York State to do that. And we now have another grant from the Department of Health, and we're working with PCG, a consulting company. They're managing the grant, but we're doing person-centered planning and training all around the state with that. And it's a deeper, thoughtful, person-centered planning process, really working with the person to really discover who they are, help them discover who they are and what they want, and then make a plan of where they want to go, and always building in the conversation about who you'd like to live with or not, and where you'd like to live and why, and also whether technology will help you live more independently. So it's sort of a package that can be used together or any one piece of it. And we're really pleased with that, and have leveraged our housing area through a DDPC grant to do housing and housing navigators all around the state to work with people to develop their own separate person-centered housing plan. And I think we have over 200 housing navigators that are trained. It's a pretty intense course people go through. And not to go into too much detail about housing navigation, but it really thinks about and helps the person discover other funding sources they may not be accessing in their community that help them enter a different housing market. And it's pretty exciting. And we are now working with individuals in each region to do housing plans and person-centered plans, building in technology if they need it, if people need it, and sort of really taking that as far as it will go with technology and being more independent. Do you want to say anything about our BIP?
Sure, I'd love to. One of the things I also want to reinforce with what Ann was talking about with the housing navigation, we have over 220 housing navigators, and part of this 36-hour very robust curriculum, a whole segment is on assistive technology. And I think, Neil, you were talking about it, is increase awareness, get those conversations going, and ask those questions, what do you want to work on, and then bring in the technology. So we're doing the best we can, and I would love this conversation about increasing it. So as Ann was mentioning, we had 3 segments of our BIP grant, and one was completely dedicated to assistive technology. And the first thing we wanted to do is provide education. So we had gone through and worked with a vendor, and it was Simply Home, but there's several other vendors, but to help us to create an all-day curriculum on getting the conversation started. And part of the curriculum included assessments, the different types of technology, even ethical considerations for using technology. So we had deployed that one-day curriculum in 3 areas of the state. We always want to be a downstate, middle state, and then also the western part. And we had, I would say, about 100 in attendance on that, and have since run that same one-day curriculum. So that's the first part, is the education, increasing awareness. And the second leg of this was a pilot. So we opened up the invitation to participate in a pilot, working with individuals who are interested in either moving to a least restrictive environment using technology, or perhaps in their current environment, and there's a concern that they may lose that current environment because of some needs. So we had, I would say, about 50 or 60 who applied, and we looked at working with, originally we were slated to work with 18, but we just couldn't say no, so we were working with 21 individuals, and I wanted to kind of share some of the stories with that. Anne alluded to one other thing that I think we have to be really mindful when we're talking about technology and the planning process, is to always have the person front and center, and also the DSP. It's essential. When we did some of our modeling, there were opportunities where the DSP was very involved and were able to give us insight with the individual and the type of technology. And there was a couple times it just didn't work out for scheduling, and it wasn't the best transition to technology, and I would have, in retrospect, canceled that appointment and waited to the DSP. So that's a lesson learned in a pilot, is making sure that you have the appropriate people around the table for this really great discussion. So we had worked with a total of 21 individuals, and I'm going to just kind of give you some of their stories. So we started out asking the question, what? You know, what do you want to do? And some of the individuals wanted to move to their own house. Some person wanted just a little alone time. And we'll kind of go through some of the things that we introduced. So a couple stories, and then we'll go through a couple of the devices that we used. We have one person, his name is John, who is living in an apartment with a younger person, and John is in his 60s, and just really wanted to spend some time alone in his apartment. And I really think that this is the first opportunity in all of his years that he was able to have some alone time. So after working with John and working with the team, we felt as if he could be successful just having, you know, originally we were looking at a smartphone to communicate if he needs anything, but we ended up going with a pendant, just something that he can put around his neck. And this is a little different because when he pressed it, it would go right to the DSP who was on call. Just made a world of difference, you know, just a little bit of alone time. And then we had two young women who were wanting to move out. Actually, with these two young women, they were at the risk of needing to go back into a more restricted environment because of their health. They are diabetics and could probably control it with diet. But it was interesting, when they were working with the nurses, they didn't feel like they were part of and in control of their diet. So they would go to the nurse, they would take their glucose level, report the level, and then move on. When we introduced telehealth, what was really interesting is both young women own their own health. You know, they would take their reading, it would get sent on to an off-site location, and if there was a panic value, then it would go back to the nurse. But they were controlling it. So one day they knew that their levels were high, so, you know, it got sent out, and then they called the center and just said, you know, listen, I just had, and I can't remember if it was a piece of pie or something. But now they saw the relationship between what their intake is and their blood sugars. And successfully they were able to stay in their apartment, and their health considers to be even better as we move forward. So I'm going to also go through some of the other different types of devices. So we had introduced in the pilot the pendant, which John used. We also introduced the telehealth, the blood pressure and the glucose level for a few individuals. And this is kind of cool. We introduced a medication dispensing unit. So this is great. There's actually a couple of them on the market. There is one unit that's referred to as a cube that will hold 30-day supply of medications. This particular one looks almost like an old-fashioned Simon game. It's a round circular disc, and it'll hold up to 8 days of medication. And what's great is it's all programmed in. So if I take medications at 2 o'clock, it will send me an alert, and definitely person-centered. So if my best modality to communicate with me is a text message, it'll send a text message to my smartphone, and then I would go over to the device and just press a button and take the medications at 2 o'clock. If I choose not to do that, and if it's a medication that could endanger my health, then I would get another alert. And if that didn't help, to prompt me to take my medication, then an alert would go to the nurse. And those are the decision-making trees. So if that medication was a vitamin, they could set it up in the system that it would be fine. You wouldn't have to need to send that to the nurse, but all very individual, specific. So that helps a person who is living on their own to maintain a medication regime. And you also, we can pull reports off the system, like how often they miss medications, how often do you have to send a second text message or a second alert, and how many times the nurse has to be involved. But a really cool way of dispensing medications. And the telehealth, which I talked about, those two women, telehealth systems, and there's so many different variations on the market. The one we used was from Simply Home, and it worked out really well. You can set up different types of sensors throughout, your area. There's something that's new on the market, which is a sleep sensor, which is just very simple. It's maybe, very simple, that you can put between your mattress and also the box spring, and it can tell you your sleeping patterns. So if you're up and down, and if you're not in the right REM cycle, it'll tell you that. And that may be important for somebody who may, have some beginning anxiety about something, so you may start seeing some changes in your sleep patterns. So that's one type of a sensor. The water sensor is the other one, so if somebody is a little bit unsure about turning off faucets and perhaps have had a history of flooding areas, you can do a little sensor. Kristen, I think you also mentioned about the stove sensors. Set up stove sensors where, if you walk away from the stove and you haven't been attentive to it, it'll send you a reminder, send you another reminder, and then it actually can turn off the stove. So it's, again, a nice little safety feature. And we all kind of have them built in our homes. If you have a security system, you can build in some of these nice features.
So we did bring a video that Simply Home made, and I think Josie's going to help us get it going, but it's a really good example of a young man named Steve who lived for many, many years in a group home, and it just happened that in a CQL personal outcomes interview, he said, I'd like to live on my own. And for years and years, they had supported him, and he'd never said anything like that, and he did need a few enabling devices, and they set them up, and I think this is just a really good story if we can get it going.
So while we're uploading that video, I just wanted...
Steve is somebody who is very well liked by community members. He participates in local events, the VFW pancake breakfasts. He goes to the coffee shops, pizza joints. Those are things that are very important to Steve. And to not be dependent on staff for when they're ready to go means a tremendous amount to him.
I like the location because I know the area pretty good.
Wildwood went through an accreditation with CQL, and Steve was a part of the POMS interview process. And during that process, Steve had indicated that he wanted to move out of the residence. And it was not something that was on the radar for the staff at all. It never came up in the multiple planning meetings that we had for him over the years.
Steve lived at the McLean Street residence. I was a counselor for Steve. I never pictured Steve living in a supportive apartment. I left the company, and when I came back, they said, Steve's in his own apartment. And I said, excuse me? Who's in his own apartment? Steve's in his own apartment. And I said, no way.
Community-supported living is a service model creating opportunities for people to self-determine how they want to live in the community. Home and community activities optimize independence and inclusion while ensuring the rights of privacy and dignity.
there was a NYSACRA BIP grant that was in collaboration with Simply Home, and I submitted Steve's story, and immediately it was something that everyone saw as a potential win.
I wanted to take care of myself more, cook and clean, and everything on my own.
Much of what was happening with Steve was incidental difficulty or inconveniences, like him losing his keys. That's an inconvenience. It's not safety. The stove, that's a real safety concern. So we wanted to ensure that when Steve was cooking, that we reduce the amount of risk to him.
When you turn the stove on, it says to take all the unnecessary stuff off and make sure it's not a fire.
If we're not given the opportunity to fail, then we're never given the opportunity to grow. Getting the supports when he needs them, as opposed to having supports around all the time, it's a much better living environment for him. What was missing from Steve's planning process was really what Steve wanted and what his dreams and desires were, making it truly person-centered. And that's where the technology really became important, because the technology allowed Steve to be able to work within the limitations that he has, but he was in control of it. He identified that this was the technology that would assist him.
Steve is so proud that he lives on his own. When he was in the residence, we had to prompt him to do everything all day long. Here, it's a pop-in. Steve, what do you want to do today?
Any kind of change for Steve has to be predictable, and he has to buy into the process. So if Steve was going to make a successful transition, any introduction of technology needed to happen early in the process, so that when he transitioned to community living, the technology would just transition with him. It was really customizing what Steve's needs were and what we know works for him, and designing the technology to meet those needs.
Well, it helps with my meds in the morning, med box, and the butler helps me too. It tells me to check the iPad.
Steve initiated, I have an iPad, let me use a checklist so that I can get through my tasks at the end of the day. So now what we then did is we introduced a new prompt into the Butler system to check your iPad.
Steve, check your iPad for your schedule.
What's really interesting is because Steve is somebody who is very independent, he has relationships in the community that we will never know about. That's a risk that Steve puts himself out there, and the community accepts him.
I took the bus to the movies too. Yeah, we go to Stewart's, yeah. It's right across the road.
Steve is more sociable now. He has more confidence in himself. He lives on his own. He will tell you that I live on my own. Like, the confidence has grown leaps and bounds.
What would Steve tell his friends who are considering moving out on their own?
I would say they should try to do it because it's good to take care of yourself.
He trusted us enough to be able to risk, and we risked together.
So the reminder system, I think, is kind of like the Butler system, and what Kristen was talking about as something else. But many of the vendors have similar systems, and you just construct them around the individual's needs. You know, I've done this presentation a few times, and lots of times people come up and are like, I need this for my elderly mother. You know, how do I get this? And we do have some great contacts. There's some links there. But one of the things we encourage is just planning with the team that's involved with anyone, whether it's the circle, the family, you know, whether it's professionals that are working with, to really be thinking about and brainstorming what the best use of technology might be. I can't underscore enough how important it is to really explore the technology and sort of desensitize yourself to, for me, it's like math anxiety, that's my thing, but I could almost transfer it to technology anxiety, and a lot of people, I think, feel that way. But there's some very simple things that can be really helpful and empower people. So we've been doing more with our technology committee at the New York Alliance, and really moving toward our members, providers, but also people with disabilities embracing the use of technology. And we have some great partners that Carol will talk about. We signed the Coleman Institute Declaration around the rights of people to utilize technology. And, we'll talk in a little bit about some advocacy we're doing to move assistive technology under the HCBS waiver, so that there's a pay for people that can plan out in their life plan a need for some technology with a limit, not uncapped resources, but some that will be really helpful to independents.
So before we move on to a little bit what New York Alliance is doing, just a couple things to keep in the back of your mind is assistive technology is not the replacement of a DSP or human contact. This is just the opportunity, like we all use technology to support our daily living. And it was interesting when they were talking about the keys, I remember seeing in the circulars this Sunday those little tiles. For $19, you can put those little tiles on your keychain and then set up the device with your smartphone so you can always find your keys. So, we don't need to have these very complicated systems. If, like Ann was saying in the session with Steve, these are inconveniences. So New York Alliance, we have a very strong assistive enabling technology committee, and some of the things that we have been grappling with is, do we want to provide or support people with a formal assessment? How do you get to that point? But it really is a discovery. It's a discussion that you have and a discussion that you have at the Circle of Support meetings, and not necessarily a formal assessment. But we thought what would be helpful is for us as a committee to start doing little videos, 1 to 2 minutes, on some really cool things that we've seen. For example, the Toby eye gaze, which is something that not all of us were aware of. We'll do a little discovery on that and do a little video so you can see the information. Then you'll also be able to see the video link. So you'll be starting to see that on our website. Josie, I'm not sure if you can bring up our site on the next slide. No, thank you. Yeah, so I just wanted to say that we are very strong about providing ongoing education and resources with regards to enabling technology. And we have on our site.
Well, I got it on the screen here.
Okay. You'll see some of the information on the BIP grant. You'll see the final report on the BIP grant, but you'll also see in the left-hand side, you'll see the videos of David, who we just saw, and also Steve, who we just saw, and also David. What we also have are 3 recorded webinars, and it goes through, certainly what enabling technology is, understanding the types of technology, and the evolution or evolving through the use of technology. And we'll continue to increase the videos and also the little snippets of new and up-and-coming type of technology. We're very committed to making sure that all of our materials, as best as possible, can be presented in a variety of modalities. So it's not always the written word, but you can actually see the device. And just to reinforce again, and you'll see that in these videos, is the significant role of the DSP and the individual when we're talking about technology.
So the last thing I think we want to talk about is just where we, the New York Alliance, are moving forward, and I think that lots of other people would agree that, we want enabling technology to be built more into the thinking of the life plans and circles of support. And we do have some, as Carol said, other states have adopted enabling technology as a possibility under their HCBS community waiver, and with a limit and a plan, and making sure that the individual person has a goal toward it. So we've been working with OPWDD to potentially get that language in the waiver. It's not just language, though. It would be for that individual up to perhaps a cap, which is how other states have done it. There'd be a cap annually or for a certain amount of time for technology buy for the person, and it could be paid for through their waiver supports. And there are some things that are already being used, but people aren't getting reimbursed for them. They're taking it out of their own personal dollars. And so we'd like to remedy that so that there was a better use of enabling technology through the waiver supports. That's one of our goals. The other thing that we've been talking a lot about is just educating people about the use of technology and what's available and what might work, and don't overspend on technology. Try to, there are some experts that can help and do an assessment that will be more helpful. There are some things we found in our BIP grant that didn't work for people, and it may just be their particular bend toward a certain kind of technology didn't work for them, or they didn't check it. But, sort of finding where that sweet spot is and best aiming towards it. And then just educating around it, the people around the person, about what the technology can mean for them, helping DSPs understand. And most of you know that we have a workforce shortage, and that's not the reason to move for technology. Toward technology. It's very empowering for people to live more independently, but it does serve to help where we do have some shortages. But as Carol said, it's not to replace the person. I mean, I think Steve is a perfect example of someone who was living comfortably in a group home for many years, but felt he had more potential, and the staff were excited to see that, but hadn't really thought about it. So those kinds of steps forward can be really successful. I think the other thing we need to grapple with as a state is remote monitoring. There is the potential to use remote monitoring. Ohio has passed, has some regulations around using remote technology in a group home for, let's just say, at night when people maybe are pretty able and sleep through the night, but to have somebody on call available in 15 minutes to be there if the person needs someone. I don't think in New York, other than some little pockets, there has been real move toward remote technology to be utilized and fleshed out in a policy, and we'd like to start exploring that.
Just a couple things. When Ann was talking about, working with OPWDD on getting some of this funded, we're talking about, the types, the categories, from the apps to the mainstream to the vendor. We're also talking about the Wi-Fi connectivity, and also some of these, such as the telehealth, requires a monthly monitoring fee. So those are the things that we would need to have under the umbrella of reimbursement. And with any type of monitoring, privacy, and making sure that this is a discussion for the team, the individual, and I always say, if possible, work with the individual, and even showing them how to turn the system off if they don't want it. And I think about like a GPS watch, and Ann had mentioned that earlier in our presentation. There is a watch, and it's gone through many different designs, but it's basically a GPS watch that helps individuals travel in their community, but it also allows you to press a button and connect with a DSP or somebody within their circle of support if they get lost. But that's considered to be monitoring also. So, it's important that, the person, that discussion comes forth through the team, and the individual is fully aware, and you'll have your own policies within your agencies, but just be careful of that too.
Yeah, we did talk a lot about the ethics of using technology, and of course, I think there would be a lot to discuss around remote technology, and 4 people in a group home would very likely need to all agree on the use of some kind of remote monitoring. And that kind of ethical conversation can happen, and privacy conversations, and there are some real experts out there that we've been working with that are really good at facilitating that conversation. So it's important to have it and not interfere with privacy and what people really want as a person first kind of support. And I think this is our contact information. Carol and I are happy to talk about technology at any point. I know probably a lot of what we talked about you're aware of, but it's just really gratifying when you see a person with a disability like Steve, who for many years kind of depended on it, and maybe he needed to through those years kind of build himself to a place with staff around him where he could feel more comfortable moving out on his own. But that's a great goal and nice to see. And you probably recognize Ballston Spa, where he's living and moving around in the community. But any questions for us?
Well, first of all, thank you.
You're welcome.
Really informative presentations. My question was about obviously more and more people know about these technologies now. I know that there could be more education, but you mentioned some potential policy changes, and I think this group would be most interested in knowing about that. One of them was remote monitoring. It sounds like perhaps you think policies don't allow enough flexibility. It sounds like it's payment policy. So if you have other ideas like that, we'd love to hear them.
Yeah, and I think, we have actually some language. We did a little studying of other states that have enabling technology approved under their waiver and how it works. And so we kind of put a lot of heads together and came up with a suggested language and gave it to OPW, and are looking forward to more conversation about that. We've been told that there's a technical amendment potentially coming up next year that we might be able to build into our waiver approval with the federal government, more ability to have a pay for. People can use assistive technology, enabling technology now, as long as everybody around them agrees. But there isn't much of a pay for, except in self-direction. I think the what is that pot of money called? Jill, help me. That
Yes.
IDGS. Yes, there is a pot of money in self-direction that can have some limited support toward assistive technology. And of course, that's in self-direction. That's a great place for it to be, where people could spend some of that pot of money toward technology that it helps them. But for anybody getting a waiver service, it would be nice if they could opt for with some kind of limit on the amount of dollars spent. The one conundrum, I think, is whether an assessment should officially be regulated and in OPW or New York State language. Does a technology assessment need to happen, and who does that? And for the most part, there are some really great experts out there, but it's not across the board. It wouldn't necessarily be a clinician necessarily that would know all the ins and outs of technology needs. So it's kind of like a team. And I don't think Carol and I and our technology committee have kind of quibbled about this. We haven't settled on whether a technology or an assessment is a good thing or not, but we certainly love the conversation around how you would more officially recommend a piece of technology for someone, or that they wanted to live more independently. And could be helpful when you have more expertise in that person providing the assessment, that they know everything that's available rather than just off the shelf. On the remote monitoring, in Ohio, they have some official legislation, and they built in a piece of, for people at night when you maybe had to have an awake night staff person that you were paying for. They built in that some of the return on investment around using remote monitoring would go back to DSP wages. That was just Ohio's idea for a workforce crisis where wage enhancements are needed for line workers. I don't know how much they've moved forward with that except in a pilot. They are a technology first state as declared by the last governor, Kasich. Ohio. They did make some efforts to move forward, and I think they've gotten stalled since, but you may be more up to date, Carol.
I think that's pretty accurate. Courtney, one of the things that often we ask is having a list of technology available. And you really can't in this day and age because it's always changing. So you really have to understand why you're going to be using it, and then just do a quick little Google search because technology is always changing.
Bill, did you have a question?
Sheila, you've seen this presentation before.
I have, actually, but that said, I would say it's kind of safe to say that, all of us have been grappling with how to use technology, where does it fit, so on and so forth. At the moment, the council is moving in the direction of looking at technology through the prism of uncertified setting. But you said something in one of your earlier presentations, and I've heard it come up from the membership in a couple of the small work groups that we've put together. You had said that the direct support workers were sort of seeing the technology as a threat to them. Mm-hmm. I would say in the last 2 years that the conversation around technology supporting people with developmental disabilities has become very robust. I've noticed just in the last year a significant uptick. But in this short window of time, do you see any change in that? Are the direct support workforce starting to see the technology as something that helps them and lessens their burden, or are they still afraid of it? Or is that something the jury might not be back on yet?
I think the jury's not back on it, but what it does mean is that you need to provide more education about the reason for and what it all means, and that it's, your position is secure to support people in other ways and to support this way. I think what we learned is it's just don't go in and unilaterally provide a piece of technology and think everybody understands why it's there. I think it's really important to have the whole conversation with staff about how it can make a person more independent or feel more independent. Maybe not like the glucose monitoring, where there maybe was some savings on a nurse's time, but really what it was is empowering the two women to take more control of their own health, where a lot of times we've, and I think this is true of our DSPs, we're moving gradually over time from a care for to a support staff person. And that does not mean that there isn't sometimes hands-on care needed of some people, but it really is a mindset toward more empowerment, I guess, and that how powerful that can be. And I think you see that in the video with Steve, where he is just almost giddy with the idea of living more independently and on his own. We've heard the same with a number of the other people in the pilot. We did have a failure, didn't we? Have one, Carol, just to. Of our piloting?
Yeah, there's a couple, and it goes back to your question, Sheila. A couple of the DSPs didn't see for themselves the value of technology, or I shouldn't even say DSPs, but sometimes we don't find the value of technology. We may not have a smartphone. I think that was where one of the barriers were, is to bring everybody up to speed and talking about the roles of technology. We had, and this has certainly been, 5 years ago, a little less than 5 years ago, but the technology for the GPS smartwatch wasn't ideal. I think since then, they've come up with a different type of a GPS watch, but the one that we were using at the time wasn't the ideal.
Well, we've certainly had our share of pilots that didn't work out, but
Yeah.
you learn as much from them as you do the
Exactly.
successes.
Oh, absolutely.
Exactly.
Absolutely. I totally agree.
Thank you.
Thank you.
Yeah, actually, this is a question, and I'm not sure the answer to it. The conversation that you went through today, I think, is more focused on individuals who've been in receipt of services and formerly in certified residential settings and wanting to move out to be more independent. I'm just curious if there's been engagement on behalf of individuals living at home with family to support their loved one to remain at home in a way that is they're enabling their ability to be as independent as possible in their home environment with their family member. Have you had any trainings geared toward individuals who live at home with their family to support them in that environment more effectively?
So maybe not as much, although everything is on our website. We're a provider association, so we work through our provider members. Obviously, when we present at the DDPC, I've presented at family support conferences. You're touching people that are really interested. I sort of think we need that pay for under the waiver to really move forward. Of course, the self-direction IDGS is fantastic, but it's a little more limiting when it's coming from somebody's own pocket. That they need to provide that. But, we'd be happy to, in fact, Carol has some ideas that we should move into some bigger grant areas for our technology direction, and I'd really support that. So I hope we can do more in that direction, for sure. All the technology that we talked about could be useful at home, but you're right, we may not be touching all families and people. We've presented at the Self-Advocacy Association on technology, too.
Thank you. I had a
question.
Yeah, I had another question. And just in terms of thinking about individuals in your pilot, did you pilot the technology with the individual while they were still in the certified environment for them to become accustomed to the tools and then made the transition out? And if so, is there a certain profile of individuals that you've identified that are most able to benefit from and use the currently available technology? And I realize it's always evolving. But just in terms of knowing who should we really be targeting as the audience that can actually really use and benefit from this type of technology to enable their more independent living. You know what I'm getting at?
Yes.
Yeah, absolutely.
And I'll let Carol go in a minute, but we didn't always target people that were going to move out of. Some people would continue to live in a group home, say, but be more independent or have more alone time. So it was our goal with the 21 people in the pilot was to help people live more independently, not necessarily move out, but we had people that did that, and I'll ask Carol to give more on that.
Yeah, and you may remember from Steve's video, we introduced the technology in his home before making the transition, and that was really very helpful because he had his natural supports right there and was able to bring in the technology, and it was a nicer transition to living on his own with the technology.
Get comfortable with them, yeah.
Yeah, absolutely.
Okay. And again, I think the other question I threw out a lot was around is there a certain profile of individuals just in terms of what their strengths are that may make them more amenable to using the technology to be more independent? Have you learned anything
there
on that?
probably is, Jill, but given how Wildwood worked with Steve, and he came kind of from nowhere, so to speak, so I think the conversation should be had with everyone. But I do think intuitively there's some people that we feel have more potential. We as staff, as observers, people in their lives that have more potential to live independently, sometimes have just gotten accustomed in a 24/7 group home to people being around them, and maybe uncomfortable with the idea of living more independently without a button to push or somebody to call. So, in some ways, we've done a great job providing lots of supports, but I think that we should broach the subject with everybody that we can, and have that conversation. And maybe it's just a little piece of technology that's going to help someone, not a whole butler system when you move into your own apartment. So I don't know, Carol, what do you think about the person?
I absolutely agree with Ann, and I think it's the interest level of the person. And I think about my 92-year-old mother who sees everyone with their smartphone, so she wanted one. And I think we're all exposed to technology, so it's if you're interested or not in the technology, and if your desire for living it more independently, your choice in using technology. So it really goes back to person-centeredness.
Thank you.
Just to comment that last conversation almost gets you back to the beginning about the assessment and what does it look like, and is there some sort of general assessment that you might apply to folks just to start the conversation across the board, so that you wouldn't make the mistake, I guess, of thinking that somebody wouldn't be interested or have the need for technology when they very well might if you engaged them. And so it might be good if you folks could look a little bit at what that might look like. And some of the simplest assessments are the ones that work the best. I'll just say that I'm an audiologist by training, and years ago we used something called the Client-Oriented Scale of Improvement. It's probably still on the Oticon Hearing Aid Company's website. It's the simplest discussion. It basically starts on the left side with asking your patient what they're interested in getting out of hearing aids, and that's what you use to measure the outcomes on the right. It couldn't be any simpler, but maybe something along those lines that could be more across the board and bring this into the conversation so that it's not unusual or fearful for people to think about assistive technology.
Absolutely.
Great comments.
Two really quick comments on that is on our website, you'll see just more of a discovery survey, and start having those conversations about technology. And the second part is we do have several different examples of assessments that we've been collecting over the years, so it wouldn't be a hard crosswalk to make something that's simple but guided for staff and the individual.
I think, Jill, back to your question before about people at home, there is another video on our website, which is why Josie was a little confused, because we did have it built into to show both videos when we can. And this is David, and the perspective of that video is from his mom, who she was very fearful of his living on his own, but he wanted to. And she is able to go onto the computer and see if he's gotten up and if he's taken his medication, and without calling and nagging him, and she says that, that, he has a comfort level and she has a comfort level. And it's on our website too. It's a nice one to take a look at. Everyone in it has a Tennessee accent, so I always have a hard time understanding what people are saying, but it's a really good video. So there is a group of family members that would like to see more independence, and yet can kind of keep an eye on how things are going.
Great questions. Thank you.
Just one quick comment, or it may even be a question. What's your recommendation for ensuring that when a individual is with independent living as the goal, but while they're still in school, do you see that there needs to be some type of change in how we administer assistive technology at the school level to ensure that for these individuals that there is that transition is smoother to the technology that they'll need for independent living? And is there an overlap in the type of technology that we could start to bring down to the classrooms to get, so the transition isn't such a heavy lift if it's completely different than what they've been using in a school setting. As we work, as the state education department looks to really focus heavily on assistive technology in the upcoming years, and really update our guidance and resources around assistive technology, it's important for us to ensure that for this population of individuals that we're creating a smooth transition for them.
Oh, good question. I'll let Carol dive more deeply into it, but I think they're probably already using some apps or some tools in the classroom, and just getting exposed to and using some of those will be really important.
Yeah, and I would make sure that you align the technology in both environments. So, if you're using an iPad in the school setting, or if they're using it at home, making sure that the same type of technology or the same general technology, even the types of devices, whether or not it's something that is an Android versus an Apple product, but just aligning the types of technology and also the manufacturers, I think would be helpful with the transition.
I like your question, though. I think we have some more work to do in that area.
All right, and just to add one quick thing. The Bureau of Early Intervention has worked for quite a few months now on updating its assistive technology guidance document. So when I saw this topic today, I was pretty excited to hear it. We had a guidance document from about 1999 that we recently updated. So, we're all in the same boat on these things. So I was just thinking about what you said, Chris. So we'll share that with you and with the special ed policy folks for sure, because we do think hard about transition even from birth to 3 to preschool, and about technology procured, especially toward the end of a stay in early intervention when the preschool might use something different, and we might want to have an eye toward what is going to happen in the next system. So. We'll share that with you, and we can share it with you folks as well.
That's wonderful.
Oh, fantastic.
This is great discussion.
Yeah, really good discussion, and I think I at least heard what I would consider somewhat recommendations about the waiver and getting funding for it, some comments about assessment for the technology, and comment about transition of services. So I think when we next year revisit our report and where we are with implementation of the various recommendations, I don't recall, I know we had something about assistive technology, but the details, and since I don't have the report in front of me, are escaping me, that we maybe beef that section up a little bit, and we might turn to you as resources to help us.
Happy to help. I think the conversation around remote monitoring, too, will be an important and a bigger one for everybody to get involved in. It has its own pros and cons, but I think some provider members, Living Resources, is already exploring that in their college program at St. Rose, where they have somebody back at the organization there on call if one of the young people in the dorm, needs some assistance. And it's not being paid for, it's paid for by a grant, but it's something that a lot of people with disabilities might benefit from, but I think we have to have a fuller conversation about it.
Absolutely. All right.
Thank you for inviting us.
Great conversation.
Thank you. Okay. Do we have anybody here for public comment? I don't see anybody. Okay. So I think that's it for today's meeting. Our next meeting is scheduled for April 29th from 1 to 3. At that point, we want to probably have more folks here because we'll be looking at the report, seeing where we are in terms of status, seeing if we want to add to the report, seeing where we are with each one of the recommendations. It also will be the first time that we meet after the state budget has passed, so there might be some things in the budget worth talking about. I think we'll have to wait and see. Hopefully they're good things, because it hasn't been the best news about the state budget, so we'll see. Greg, anything else from your point of view?
No, I think we will email the PowerPoint presentation to the board members afterwards, and we hope to have this, it's being webcast now. We hope to have the recording of this up on the Autism Advisory Board website within, hopefully a week or two. And there were a lot of people that saw the last one. We had emails and some public had reached out. So hopefully this will give the public a good opportunity to see and hear
Thank you all for coming today. We're officially adjourned.
Thank you.
Thank you, Kristen.
Good luck.
Yes, good luck. Bye-bye.